And our goal is to have this recording. There you go. Our goal is to have this recording available on our website by Friday. So you'll receive an email following today's presentation. We're also going to be posting a copy of the slides, so you'll have access to those as well. We're going to have Q&A following today's presentation. So you'll see at the bottom toolbar, there's a Q&A box. Please feel free to add any questions in there. Also, we have a chat box, so share any comments or ideas that you have. We'll also be posting several links that for resources we highlight today, so you'll find useful information in the chat box as well. And of course, please don't forget to fill out our evaluation at the end of this webinar today. We will also be sending that out in our follow-up email. So you can go to the next slide. So just to let you know what we're going to be talking about today. So we're going to start by highlighting the suite of ACS NCCRT communication resources and really dig into why early messaging and on-time screening is so critical. We're going to introduce the new ACS NCCRT Lead Time Messaging Guidebook, share an overview of how our market research was conducted and the findings that were used to inform the contents of this guidebook, and then highlight some really great information and tools that can be used to motivate folks to get screened for colorectal cancer on time. And then, of course, we'll have time for Q&A. Next slide. So before we get started, I really want to acknowledge that it takes a village, and we just didn't get here in one day by just ourselves. So I want to thank the Lead Time Messaging Advisory Committee, who have been working with us for literally years to not only develop and inform the market research, but also use their time and expertise to help build out the guidebook, review its contents, share editing notes. Incredibly helpful and dedicated group of folks. A special thank you to our chairs of our Family History and Early Age Onset Colorectal Cancer Strategic Priority Team, Heather Hampel and Dr. Paul Schroy. They provided vision, leadership, and ongoing guidance. We could not have done this without them. KS&R, who you'll hear from in just a bit, did a phenomenal job of taking our feedback, conducting the market research, and analyzing it so that we could use the results for this guidebook. A big thank you to the American Cancer Society and the CDC for providing funding and staff support. And I want to give a special shout out to my colleagues, Aubrey Thielen, who is our producer today. So if you have any IT issues, please feel free to message her. She's under the National Colorectal Cancer Roundtable name. And then, of course, Emily Bell, who I know all of you know very well, who will be monitoring the Q&A in the chat for us. And we also want to acknowledge that, again, it's been a journey, and we have incredible gratitude for Dr. Whitney Jones, who's really championed this lead time messaging concept, as well as two late colleagues of the ACS NCCRT, Dr. Thomas Weber and Dr. Dennis Anand, who were instrumental in promoting our adoption in this paradigm shift. Next slide. So aside from myself, you'll also hear from two other wonderful presenters, the chair of our roundtable, Dr. Stephen Itzkowitz, and Michelle Aubertine, project consultant with KS&R. So I will pass it on to Dr. Itzkowitz to share about NCCRT's other communication resources and current rates on colorectal cancer screening.
Thank you so much, Caitlin. Welcome, everyone. Thank you for spending an hour of your precious time with us. We're very excited about our latest resource on lead time messaging that we're going to share with you today. So as Caitlin said, the Roundtable has a whole suite of communication resources. In fact, we really started back about 10 years ago with our first market research project. And these are meant to really understand the barriers and emotional motivators that really influence screening behavior. And as you see, we had a few general guidebooks, but over the last few years, more recently, we really honed in on certain populations where we noticed lower screening rates. So we developed guidebooks around the Hispanic and Latino community, Asian Americans, people who are unscreened, and a guidebook for Black and African American people. So this latest guidebook is really a continuation of that concept of trying to get every corner of the country in for screening. So that served as the basis for the current lead time messaging project. Next slide, please. So why is on-time screening important? Well, you can see from this graph that people that are 45 to 49 are getting screened only about 20% of the time. And really that's part of that is because the guidelines lowered the age to 45 only a few years ago. But you can see that, a lot of those guidelines have been in effect now for some time, and the 45 to 49-year-olds still lag behind. In fact, so does the 50 to 54 group, and that's been present for quite a while. So we really want to focus on the younger populations because we notice in the last decade or two that colon cancer incidence and mortality rates are increasing in people younger than 55. And it's been estimated that adherence to current guidelines could potentially prevent 16% of young onset colon cancers and result in an earlier diagnosis in about half of them. Next slide. You may have seen last week the American Cancer Society Facts and Figures 2024 that Becky Siegel and her colleagues published. This comes out every year, and it's always a rather sobering document, which gives us guidance for our work ahead. And we still have 153,000 people in the United States diagnosed with colon cancer and over 50,000 dying from the disease every year. And again, only 59% of adults 45 and up are up to date with screening. And it's, as you saw, low in the younger populations. And 3 in 5 people are now being diagnosed with advanced stage colorectal cancer, which is unfortunate. And 1 in 5 people are younger than 55. So as you can see from the banner to the right, it's estimated now that of all cancer deaths in people younger than 50, colorectal cancer is now #1 in men and #2 in women. So a huge problem in the younger population. Next slide. So how do we increase on-time screening? The concept of on-time screening and lead time messaging was really championed in large part by this paper that was put together by Whitney Jones, Dennis Onen, and Paul Schroy. If I could have the next slide. And what we mean by lead time messaging is the delivery of accurate, relevant, and actionable information about colon cancer risk and risk-based screening options before the starting age that's recommended by the ACS for average and high-risk individuals. And to maximize the effectiveness, messages should really be delivered multiple times. So the time to start talking to patients about screening is not when they turn 45, but much younger. We don't know a lot of risk factors in the young population, but one thing that should be relatively easy to gather is family history, because that clearly is a risk factor. And we have a whole family history, early onset colon cancer strategic priority team, and we've held symposia and summits over the years, along with a toolkit that was developed to help you acquire adequate family histories. So it's really important that you all who are dealing with this population take a good family history. We can also increase on-time screening by building our success and our popularity from various messaging resources, and that's why we're holding this webinar today. We want to identify best practices for messaging and educating colorectal screening before the recommended screening age. Next slide. So the goals of the Lead Time Messaging Project are really to better understand the perceptions about colon cancer itself, colon cancer screening, and interactions with the healthcare system, and to really identify messages that we can learn that heighten awareness about colon cancer and the importance of on-time screening. We want to motivate and empower individuals at both average and familial risk to discuss screening with their providers before the recommended age of initiation, and really to determine the effective messaging that best resonates with different target audiences. And as you'll hear very soon, a lot of this market research targeted different age groups younger than 45, and you'll see that the messaging in some of these subpopulations might be a little bit different. Next slide. So I'll now turn it over to Michelle from KS&R, who's done an amazing amount of work in this area, and she'll take it from here, and then we can answer some questions towards the end. Thank you.
Thanks, Steve. So my name is Michelle Aubertine. I work for KS&R, and we are a national market research firm that has partnered with the ACS for more than a decade, conducting research on colorectal cancer screening among various audiences. And for this particular focus, looking at on-time screening messaging for the younger audience. We conducted 3 phases of research. So if we go to the next slide, just give you a little background on those. So the first 2 phases, one was an online survey conducted with individuals ages 20 to 49 who have not been screened for colon cancer. Phase 2, we conducted some one-on-one interviews. It was a qualitative approach with individuals within that same age range, again, who have not been screened. The purpose of these first 2 phases was really to understand the current state of this younger audience. What do they know? How do they currently feel about colon cancer and colon cancer screening? Essentially, we wanted to identify any gaps in knowledge, as well as any misconceptions this younger audience may have. That way, we can identify the type of information that should be shared to craft impactful messages. Additionally, during these first 2 phases, we tapped into their attitudes and perceptions with regard to healthcare in general, where they prefer to receive health information, who they trust to give them health information, overall just to understand how to most effectively reach this younger audience. Then in the third phase of research, we conducted a short online survey. So based on the results from phase 1 and phase 2, a committee came together and they developed 12 different messages for us to test and to see which messages would be most impactful and resonate with this particular audience to encourage on-time screening. And we'll talk about the results of those messages in a bit. So what did we learn on the next slide? So the first thing we asked them, top of mind before we got into any facts or figures, we just said, when you hear the word colon cancer, what do you think of? And top of mind reactions relate to the seriousness and the awfulness of this disease. But we also saw comments that were kind of peppered with the misinformation that, we tend to hear. Things like, it's for older people, it's more common in men. So definitely there's some misinformation within this group. We also asked a similar question, when you think of screening for colon cancer, what do you think of? Colonoscopies was number 1, but right behind that was probing and digital rectal exams. And then the third most common thing we heard when we asked them what they think of with regard to colon cancer screening is a sense that it's scary, that it's something to be nervous about. And what we learned from previous research we've done is that last one, kind of fear, is a key barrier when people reach the screening age. So something to keep in mind, as we're trying to reach this audience. And 1 in 10 said nothing really comes to mind. When they hear colon cancer screening, they're like, I can't think of anything. On the next slide, I do want to touch base that within this survey, we did reach individuals who have a family history of colon cancer. So 1 in 10 of the individuals that we surveyed report having a family history. Some people mentioned they acknowledge that they could have a family history, but they might not know it. It's kind of taboo, not something they may talk about often with their family. Then we even had some individuals, report that they've had a family member that had colon cancer, but they didn't attribute that to being a family history. They thought it was due to lifestyle choices. So, the person didn't exercise, they drank too much, they ate poorly, and they didn't really think it was something that could happen to them. But on the right side, looking at those that did report having a family history, less than half have even discussed their family history with their healthcare provider. And only 1 in 5 have discussed screening with the healthcare provider. Again, they're not, they might not be of age yet, but it's still kind of eye-opening that the conversations aren't happening with healthcare providers. And then when asked what they plan to do with regard to screening, 3 in 10 said they're going to wait for their healthcare provider to bring it up. So they have a family history, but they're not going to proactively bring it up. If their doctor asks about it, then they'll talk about it. Some other facts. So how they feel about colon cancer. The majority admit to being scared of the actual procedure or test. They have family history, and you have 55% saying, I'm scared to get tested. 20% say they're too young. They haven't given it any thought to screening. Just over 1 in 5 admit they feel embarrassed talking about colon cancer or screening for it. On the plus side, 6 and 10 note that the recommended screening age is 40 or earlier. So when we asked, you'll see on the next slide, we asked if they understand the screening age, and they know they need to get screened sooner. So on the next slide, so the ultimate goal, right, is to increase the rate of on-time screening. So the first thing we needed to see is if they knew what age that was. So we asked respondents what age they thought people who were considered average risk, so no family history, no symptoms, what age do they think they should start getting screened? Only 14% said age 45. Now, as it was mentioned, the recommended age of 45 is a newer guideline instituted over the past few years. So you're probably thinking most people must have said 50. But really the fact is this younger audience, they just don't know. People gave a wide range of responses. We had just as many people, if not more, citing ages less than 45 as we did citing 50 and above. So it was really all over the place. And what it boils down to is that the younger age group just doesn't know. Now, on the plus side, most are in agreement that everyone should get screened when they reach the recommended age. So when we informed them that the recommended age per the ACS guidelines was 45, we asked them what they think people should do. And the group was pretty split between deferring to whatever age the doctor tells them to do something, whatever age their doctor says is best, and then an equal share saying they'll follow the guidelines. So, the physicians are a critical part on getting this audience to screen. And then just one more thing to point out. So we did have a subset of individuals that were in that 45 to 49 age range. So they were either at age or past the recommended age. And when we looked at what they plan to do, 4 in 10 said they're still going to wait for their healthcare provider. They're not going to bring it up. They're not going to screen until their healthcare provider mentions it. On the next slide, so this younger audience, they haven't thought much about colon cancer or screening. They don't know a whole lot about it. There was even quite a few, particularly in the interviews that we were conducting, that mentioned, it's probably more common than they think, but it's rarely talked about, unlike other cancers. Particularly, many were mentioning breast cancer is often talked about. So most agree that it's important it's important to increase awareness of colorectal cancer and colorectal cancer screening. And when we asked when people should be educated, they're also in alignment that long before the recommended screening age. Again, messaging early helps take, kind of the tabooness out of it. You have to hit people multiple times, so it'll stick with them more. And this age group is in agreement with that. They're open and receptive to learning more. So on the next page, we're going to go more into the messaging, just to give you some background, and I don't want to get too stuck in the weeds on methodology. But as I mentioned, based on the earlier phases of research, 12 messages were crafted. They had varying themes, some related to cancer being preventable, some around family history, others about being proactive about your health. We then took these 12 messages and tested them using an advanced analytical approach. It's called MACSDIP. To help identify which messages would be most impactful in encouraging on-time screening. So how this worked in the survey, respondents were shown 3 messages at a time, and they were asked to select which one would most motivate them to get screened on time and which would be least likely to get them screened. And they repeated this exercise over a series of screens. Then on the back end, analysis was conducted to assess the impact of each message. So on the next screen, here are the results, and these are shortened messages. We can get you the full messages, but overall, when we look at the bar chart, that's showing what we call share of preference, which essentially shows how impactful a particular message is relative to the other messages that we tested. So you may look at this and say 14% for the top message, that looks low, but what that 14% is really showing you is compared to lower messages. So if we look down at those messages towards the bottoms, the 5.4, the 5.1, the 4.8, those messages. That 14% is saying that eat well, work out regularly, that kind of proactive health message is 3 times more motivating to this audience than those lower messages. And so that's how we identify the most motivating messages. And so for here, based on that, there's the message, the proactive message about being proactive about your health, followed by colon cancer being a silent disease. Those were kind of top ranked. Also highly motivating, we had 2 messages around colon cancer expecting to be the leading cause of cancer deaths among 20 to 49-year-olds, as well as it being on the rise among young adults. Now, off to the right, we show the percent ranked top 3 for a message. So the analysis looks at the messages and shows what percent of the time that message was in the kind of top 3 for the respondents we surveyed. So the Eat Well message was in the top 3 for 30% of respondents, while colon cancer being a silent disease is in the top 3 for nearly 50% of respondents. What that indicates is that Eat Well message, for those that are motivated by it, they are strongly motivated by it. So often when that message did resonate with an audience, it was the #1 message that got to them. Whereas silent disease is a message that is also strong, it'll have a wider reach, but it may have slightly less often been in the top spot for individuals that we surveyed. On the next slide, we looked at it to see if the messages varied based on different age groups. As you can see, all 3 top messages perform well across the age groups, though the #1 message might vary across depending on which category you're looking at. The very last column, so those are the family history. When we look at what messages resonate most with that audience, colon cancer being a silent disease is a top ranked message, as well as it's being expected to be the leading cause of cancer-related deaths among 20 to 49-year-olds. So when looking at those with the family history, those are the 2 most impactful messages. On the next couple of slides, so we'll look at why these messages resonate so well with these audiences. The first message is most compelling to those that rated it highly because when most people think of healthy habits, screening isn't top of mind, but this communicates that it should be. It helps them think about their health in a different way. And then below, and we've seen this in other research we've done, the silent nature of colon cancer is what stands out. It makes it scary to some people. It's kind of, fear based. And we've seen this in other research. People didn't realize it was a silent disease. Knowing that, it kind of makes them think about screening differently. And then on the next slide, so the other 2 messages that we said performed well. You want to go to the next slide? Yep, thank you. The next 2 messages that performed well were related to colon cancer being on the rise in young adults, it being the leading cause of cancer death, and why these 2 messages are most compelling to this audience is because they can identify with the messages. They fall within that age range, that young adult demographic that is referenced. It's no longer in their mind a disease for older people. It's impacting themselves, it's impacting their peers. And so these messages are powerful as well. So we identified themes and types of messages. So now how do we get these messages out to the audience? So on the next slide, we'll look at channels for preferred communication. So discussions with healthcare providers, that's the most preferred way. They trust their doctors, they rely on their expertise. So now with most being below the recommended screening age, they have not had any discussions with their doctors. So healthcare providers will be a critical part of this kind of early messaging. Beyond healthcare providers, other top channels for information include websites, online patient portals, emails, so that electronic medium of communication, as well as their family and friends. Now, although social media was not identified as a trusted source per se to get there or a preferred source to receive healthcare information, it is important to show that most are on social media, most often Facebook, YouTube, and Instagram. YouTube is actually the top platform used by 20 to 29-year-olds. Facebook leads among those 30 and older. So it's definitely a viable channel that shouldn't be overlooked when it comes to reaching and educating the younger audience. And lastly, who should deliver the information? So on the next slide, of course, as we mentioned, doctors and other healthcare workers, they lead as being who individuals most want to receive health information from. They're the most trusted sources. But national health organizations such as the ACS, as well as government health organizations, they're not far behind. They also have a high level of trust. So again, healthcare providers, they're the key piece of educating and encouraging on-time screening. Most younger individuals visit their doctors regularly for checkups. We know that from this research. So there's many opportunities to start having those discussions early. And content, whether it be on websites, advertisements, social media, if it's backed by organizations like the ACS or the CDC, that'll hold a lot of weight with this audience as well. So the current state of the younger audience, they know that colon cancer is terrible. They know it's scary, but they don't know much else about it or about screening. They haven't heard much about it either, but they agree it's important to be educated. They want to learn more. And what the research shows is that early and more frequent exposure to information is needed. And that takes us through the overview of the results.
Great. Thank you so much, Michelle. That was wonderful. And so with all of that great information, our goal was to then figure out how to package it in a way, also including helpful tools and resources from previous ACS NCCRT communication guides, and package that in a way that's helpful and easily accessible to folks working in clinical settings, public health professionals who are working on messaging campaigns focused on increasing not only uptick of colorectal cancer screening, but on-time colorectal cancer screening. So our intent with this guidebook was to, again, share those best practices around messaging and educating, encourage people starting in their 20s to discuss family cancer history, including colorectal cancer as well as colon polyps, and then of course take action as needed. Really encourage people to talk to their families and their healthcare providers. And then again, can't say this enough, make it a priority to get regular and on-time screening. So you can go to the next slide. And this is really just a high-level overview of how we have the guidebook outlined. So we start with some key definitions and screening recommendations. So you've heard a lot about on-time screening, lead time messaging, family history. We wanted to outline those so we were really clear about what we meant when we were referring to these throughout the guide. So I find it's really helpful. We also talk about colorectal cancer risk factors, and then have a little spotlight on Lynch syndrome if you're interested in learning more about that. And then of course we include the American Cancer Society screening recommendations for those who are average risk. And then some things to keep in mind if you are at a heightened risk or increased risk of getting colorectal cancer. We then move on to share national data and screening rates, highlight those recommended messages that Michelle was able to share, and then dig into those helpful tactics to remember when crafting tailored messaging campaigns. And then, of course, it was really, really important to kind of carve out a focus on those with family history. So the next slide, this is not the only definitions we've included. You can kind of see just an example. We really tried to be specific about what we meant when we were referring to on-time screening, lead time messaging, tailored messaging, and things like that. So these next slides we can go through pretty quickly, Aubrey. So we started by doing kind of these main pages with the top messages, what we learned about why they're compelling, and then some feedback that we got from the survey respondents. So I could have 0 signs and symptoms and still have it. This makes me want to get checked and not wait until it's too late. And we tried to include some comments from each age range. So this is our top message. You can go to the next slide. Then we have eat well, work out regularly, don't smoke, what else? Michelle also alluded to this, but for folks who generally eat healthy, who exercise regularly, messages that were, sharing information about colorectal cancer screening as part of a healthy lifestyle were incredibly relevant and compelling for this group. So we definitely want to include these ones in there. And then you can go to the next slide and the next slide. So these are just two more examples of that. We found it, go to the next slide. We found it incredibly important just to acknowledge tactics that should be remembered when crafting tailored messaging campaigns. So there are just these common fears and anxieties related to colorectal cancer and colorectal cancer screening, and that's okay. Folks indicated that they're afraid of receiving results. So one way to kind of to combat that is, wow, after the fact, when you learn what's happening, what a sense of relief that will bring. So just kind of having open and honest conversations is incredibly important. As we just talked about, motivations and values can really affect how messaging is received, as well as utilizing proper channels and messaging mechanisms, like Michelle was talking about. Much of our market research, people indicated that they don't like receiving health-related information via social media, but it's hard to discount the amount of people that are on social media and utilize it for getting news information. Next slide. So our focus on family history was really, really important, and that's because we found out that folks aren't receiving personalized counseling. There's a lack of limited understanding. People with a family history are not talking to their clinicians about it. It hadn't been sufficiently tracked. And there's a lack of awareness that screening could be different for those under the age of 45. So we've included those top tested messages for those with a family history, as well as top tested messages for talking with family about colorectal cancer. We also included a highlight and link to our risk assessment and screening toolkit, which is a really, really wonderful resource, and I encourage you to check that out. And I see Emily just put it in the chat box. Thanks, Emily. Next slide. We pulled from past resources, like I said, and also successful tips from folks who've utilized this resource we've highlighted in case studies. What channels should be used, what trusted sources, social media, and then additional ways you can amplify your message through visuals, culturally appropriate messaging, messages delivered by community leaders, and really hearing from those with lived experience, hugely impactful and incredibly important. Next slide. We decided to do spotlights on some areas that, we thought deserved a little bit extra notice. So can't say enough about the importance of a clinician's recommendation. It's the most trusted source for relaying health information, and people are more motivated to get screened when it's recommended by their doctor or another medical professional. Many people under 45 have health insurance coverage. Now, granted, this isn't everyone, but for those who have coverage and see a clinician regularly for routine exams, what a missed opportunity to not be having those conversations with them. People tend to trust their clinician, and if something's being recommended, they assume it's for good reason. They're also less likely to bring it up on their own. So a clinician proactively bringing up really helps to make that change in motivation. And then clinicians have the added superpower of reducing serious mortality by using family history to assess risk. They can promote primary prevention and also evaluate patients for signs and symptoms regardless of age. Next slide. So Steve mentioned that different messages hit basically with different age groups. So we kind of broke each age group out, and we include insight into what sort of social media they use, what type of messages they're looking for, and then what tailored messaging could be helpful for this group. So for example, for 40 to 44-year-olds, it's really important that they know that there are screening options. It's not just a colonoscopy. And if you're of average risk and you don't have any signs or symptoms, maybe an at-home test is also an effective screening method for you. Next slide. And then of course, we wanted to include easy links to our other resources that can help support this work. So last year, we also released the Tailored Colorectal Cancer Screening Messaging Toolkit, a practical coalition guide. This is really focused on comprehensive cancer coalitions, but anybody can pull great tips and tricks from it. And we have 5 case studies from different groups. And I see Tamara from Nebraska joined us today, from different groups who used targeted messaging campaigns to message to their communities about colorectal cancer screening. And just as a plug, we know that this is an evolving space and an evolving document. We really want to learn what's happening in lead time messaging, what folks are doing, and how can we promote that great work. As I mentioned earlier, the risk assessment and screening toolkit, really, really great. The steps for increasing colorectal cancer screening rates, as well as those case studies, are another wonderful examples. And then, of course, our 2022 guidebook for Black and African American people, as well as the 2019 messaging guidebook. Next slide. So given the American Cancer Society Cancer Facts and Figures that came out last week, and really the chilling data about colorectal cancer, especially those in under 50, we know that this is not the answer, but this is definitely part of the answer to this problem. And the important thing about messaging and on-time screening is this is something we can all work on today and right now. So whether you work in health systems, community health centers, a health plan, a nonprofit, you can start to use tested messaging and market research findings to spread awareness to communities. And what better time than as we're heading into March for National Colorectal Cancer Awareness Month. We really want to hear from you. We want to hear your feedback. We want to hear what's worked, what hasn't, because it's important for us as the National Colorectal Cancer Roundtable to share best practices and to spread awareness around tools and activities that have been impactful. So we want to highlight your success in your work, whether it be through our social media channels, our newsletter. We could potentially even do it on our March webcast. But yeah, we really want to hear from you. So with that, I will turn it over to Emily Bell, and we can move on to questions.
Great, thank you so much. Of course, I had a little computer freeze right as I was coming over here. That was fantastic. Thank you so much. So we'll start off with a question for Dr. Itzkowitz. And this is, given the new sobering statistics on colorectal cancer in younger age groups, what do you see as the biggest opportunity for us to leverage these messages?
A very good question. What is the biggest opportunity? It's hard to put a value on the biggest opportunity. Perhaps one of the opportune times of this year, as Caitlin said, is that March is Colon Cancer Awareness Month. And whatever you do in your local environment, maybe there's a newsletter that your clinic or institution puts out, you should just try to raise awareness for not just colorectal cancer in general, but also the fact that it's the younger people where we see an increase. This statistic that 20% of colon cancers arise in people younger than 50 is very sobering. That just 12 or 15 years ago, it wasn't 20%, it was like 8%. So we really have to, and this is a marked increase in just 10 or 15 years when you think about other cancers and how they behave. There's a dramatic increase in the younger population who feel immune. They're healthy. I'm working around, I'm fine. So I think the opportunities are really what you think of in your local environment, whether it's social media, whether it's newsletters. I think health insurers, unions, I think people who can reach a broad number of individuals really just have to try to get the message out. You know, the public is barraged with all sorts of health information, right? Cholesterol and hypertension and all that. But perhaps this time of year, we can really redouble our efforts. And the fact that the lead time messaging resource is being released now, it's very fresh. This, as you saw, this is really based on science. This is market research that's been vetted, many young people. So we know what they're thinking. We know what's being done, what's not being done. And to me, to hear that people wait for the doctor or the provider to ask them about their family history. If the provider doesn't bring it up, they're not going to mention it. And so we have to, think about all those kinds of things. Likewise, something that we've heard a lot at our annual meetings is many young people have symptoms. They have rectal bleeding, they have change in bowel habits, they might even have weight loss, and they'll tell their doctor, and sometimes the doctor doesn't think that there's anything worth working up. And so we also have to get the message out to young people that they need to advocate for themselves when they might have symptoms. A lot of our conversation today is healthy people, no symptoms, walking around, no risk factors. But we also have to keep in mind that if somebody has symptoms, they have to really report it, and the health system has to take it seriously.
Great, thank you so much. Next question we have, I think would be one for you, Steve, as well. When requesting a colorectal cancer screening, typically how long does it take to get that screening? And also, would a separate appointment need to be made in order to complete the screening?
Yeah, the time to get a screening test varies by where you work. If it's a colonoscopy, that's the screening test. It can be in many environments a few weeks, but in some places that have fewer endoscopists, it might be several months. And we know that the longer it takes to get an appointment, the higher the no-show rate is, because people either forget or they feel, well, it's not that important if the doctor's not going to do it for 3 months or 4 months. So colonoscopy, it varies. And so you have to really understand the environment that you're working in. If it's a stool-based test, it can be done quite quickly. FIT tests can often be given out in clinics. If it's the multi-target stool DNA test, that can be ordered and sent from the laboratory right to the patient. So most of these tests can be done relatively quickly. And I think it's really important that you try to do it quickly because it's on everybody's mind, and this way there won't be any delays. A parallel conversation is once a stool-based test it comes back and it's abnormal, it's positive, you're really on the meter. Studies show that you really need to get a colonoscopy to follow up an abnormal stool test within 60 to 90 days. If you wait a few months, the data shows that you're then allowing things to become more advanced, either an advanced polyp or cancers that are more advanced. So that timing is very critical. An abnormal stool test has to be followed up with colonoscopy quickly. And we know that that's not being done nationally.
Great, thank you so much. Before we get to the next question, and we have a good bit of time, so please don't hesitate to submit your questions in the Q&A box. I also want to invite you to share comments. So if you have ideas already on how you're going to use the messaging within your organization, with your patients, members, or even personally, we'd love to hear about it. So please share some comments about how you plan to use the messaging, and we can all learn from each other. So next up, this question I think would be a good one for you, Caitlin. Given the many options on testing that are available, have you considered messaging that it is easier to get tested now with so many options, that colonoscopy is not the only option? And has this message been tested? And if so, how was that received?
Yeah, that is a great question. And I'm actually putting a message that we tested for our 2019 guidebook, and then we retested it for the 2022 messaging guidebook for Black and African American adults. And as you can see, colorectal cancer, colonoscopy isn't the only option for colorectal cancer screening. There's simple, affordable options, including tests that can be done at home. Talk to your doctor about which option is right for you. Both times this message tested incredibly high. So with that, I would recommend within this guidebook, putting those links to some of our other messaging resources, because with this guidebook, it was really focusing on the concept of screening itself versus digging into the different screening options. And Michelle, I believe some messages about screening options were in there, but they weren't as popular. The respondents didn't indicate that they had as much impact, but absolutely incredibly important, especially for those who are of average risk and getting close to 45.
Yeah, I think this audience is the mindset that they're nowhere close to being of age to be screened. So the options really aren't so much a factor for them. as you said, those messages, when we tested them with people that were of age or beyond the age, they resonate really well because fear was a key barrier preventing them from getting tested. So knowing they have options was impactful. So, I mean, definitely something to educate the younger audience on, but it's not going to necessarily motivate on-time screening as much as the other messages that they can identify with now.
Mm-hmm.
Okay, great. And the next up, we have Asian Americans are a patient population that historically in our facility do not go for screenings. Is this a common thread in other facilities? And what can we do to increase or connect with Asian Americans to encourage getting their screening colonoscopies? And I think Steve,
maybe I'll take that. Yes, I work in New York City, and we have this program that the Department of Health started about 25 years ago called the C5 Coalition. And we learned by really increasing screening throughout New York City that there were pockets in the New York City population where they weren't going for screening. For example, the Russian community, there's a lot of people in the Russian population who feel that cancers can't be prevented. They just don't believe in prevention. And in the Asian community, we see some of that as well. And, we lump a lot of Asians together. There's increasing data that disaggregates Asians, and there actually are quite a few differences between Japanese, Korean, Chinese Americans, but there also are belief systems in many of these cultures that either I'm not going to get cancer, or it can't be prevented, or I'm eating healthy and I don't have to worry about it. So I think the best way to do it is to try to identify advocates or leaders in each of those communities and try to understand how to get the messages through. What we did in New York City was, in the Russian communities, we actually put up advertisements in the buses, the subways, in Russian, to try to promote the concept of colon cancer screening. We did it in Chinatown as well. So, if you can identify segments of the population that are resistant to perhaps getting screening, they will come for it. They just have to be educated, and you need advocates from the community, because like every culture, you're going to trust somebody from your own culture more than you'll trust other people.
Great, thank you for that. And we have a question from Tamara Robinson. We know Tamara well and know your work. And Tamara, I'll give you a heads up. If you're willing, we'd love for you to come off mute in a moment and share a little bit how you and your organization have used our market research in the past, because I think we have a lot to learn from your example. I understand you might not be in a position to do so, so no pressure. But first, we'll answer your question. So you shared, what are thoughts on working with gyms or personal fitness organizations, given the health and wellness focus resonating with the younger folks? And that could be any of you. I'm curious, Michelle, if you have any particular insights into that one. Or Caitlin or Steve?
Yeah, Michelle, did you want to speak?
Oh yeah, I didn't realize I was trying to find my unmute button. I'm so used to Teams these days. No, just briefly, I mean, that is a great idea with gyms and fitness organizations to reach that audience that those messages really resonated with. And we know that a lot of the people we surveyed, they have that active lifestyle. So it's definitely a great platform.
Mm-hmm. And I see that Tamara popped up. Tamara, I wanted to give you the floor if you wanted to add a few comments to that.
Sure, as long as I have to be on video. This is great.
That's okay.
I'm ready for video. No, I mean, it's just a question. I was just thinking about that as we are, because to really appreciate the lead time messaging, and we are incorporating it into our campaign that's launching this March. So love this, thinking about the 20 to 29-year-olds and all of that, and how we can apply it now, like we've done and applied right locally to Nebraskans, but taking this a step further. So now how do we incorporate the new messaging that you guys are using, putting it into this? And I'm just thinking about like the gym that I go to in October, they had a presentation from a cancer survivor that goes there. And she brought in her surgeon, and they did like a whole workshop on breast cancer. So I was just like, man, I'm like, we could totally even do, like, maybe I should go back and ask about, like, hey, can we bring someone in for a March? Just thinking about, and lots of people are part of gyms, or they just opened a Crunch Fitness here, or there's Planet Fitness. I swear there's one everywhere. There's like 5 of them in my town where I live. I mean, so how many people go to these gyms and you get information, or they're always pushing stuff out, or it's just a thought to think about. And I think just utilizing, knowing your communities. We just think about, like, for Nebraskans, how can we take and utilize this? And how do we really push for us? And you guys know it's rural. So how do we push this out to our rural folks and really meeting them where they're at, not expecting them to come to you, because they're not going to. Last year, and can share next time we talk about this in another webinar, but that, going to a big event like Husker Harvest Days for us, where I mean, not just Nebraskans, but there's tons of states, farmers everywhere. I don't even remember, thousands of people out there, but we came to them. So just thinking of those ideas, like, how do you get to the populations that are not coming into the doctors? Or, because lots of them that we talk to, less and less they've been in their doctor, they're like, yeah, I don't remember. They don't go.
Yeah, that's a great point. I love what you said about going to them, regardless of, where you're in the country, urban, rural. I think that's a really excellent point. And, I think our call to action today is, obviously utilize lead time messaging, but also share with us what you're doing and what's working so that we can spread the wealth to the rest of our members and partners in the field. We really, we're a small team, and we really rely on you all to help us learn and help us, move on to the next guidebook or the next resource that can really help increase screening rates. So please share.
I'll also just mention that there's a lot of evidence that barbershops, salons, and faith-based organizations are very trusted places, and places where a lot of people share a lot of their health beliefs and health concerns. So those are other wonderful opportunities to reach young people. And I think this concept, we don't expect a 20 or 25-year-old to come in for screening, but we got to start young. I'll leave you with one anecdote. When we started doing our patient navigation work in East Harlem, there were a lot of people that refused to get colonoscopy. So we held focus groups. And I'll never forget this. There was a Black woman from Harlem who said, well, if colon cancer screening was so important, why didn't my doctor tell me about it before I was 50? They've been telling me about mammography since I'm 35, 40. He just started telling me get a colonoscopy when I'm 50. So how important could that be? And that's just the point. We got to do lead time. We got to get at people before they turn of screening age.
And Steve, I'll just add, it's important that these messages come early, but often. So it's not just a one and done. People need to be told multiple times, and more often the closer they get to that screening age.
Great, thank you. And special thank you to Tamara. We really appreciate you allowing us to put you on the spot. I just wanted to add to that conversation that employers are another great venue. And if your day job is reaching out to patients or the public in your state or whatnot, you can also turn to your own employer and share with them some tools on how to reach employees that might be in that age group. So in addition to the Lead Time Guidebook, we also have an employer challenge guide. So 2 sort of plug and play solutions that you can bring to your own employer or other employers that are in your networks. So we've got a couple more questions here. So one that I'll jump to this one. At the NCCRT, there was talk of, or I think that's referring to our annual meeting, there was talk of reaching out to colleges to start raising awareness about young onset and urgent care, since many young adults are not visiting their PCPs. I'll just start by sharing, we know of at least a couple of the NCCRT member organizations that have youth advisory boards, college advisory boards, even high school outreach groups. So we know that some of that work is underway. But Caitlin, Steve, anything else to add?
Yeah, I think those are very good mechanisms. I teach in a medical school, and when I teach my medical students, I ask them for a show of hands, how many of their parents have gotten colonoscopies. And, you know, a few people raise their hands, and then I say to them, go home and tell your mother or your father that unless they get their colonoscopy, I'm going to fail you, you know, in this course. So we can leverage upwards. We can take young people who are showing up in clinics and not only educate them, but you know, make sure that their parents have also gone in for screening as well. So you know, whatever, it's a multi-pronged approach. So anything that we can do is going to be helpful.
Yeah, I really love that. Okay, Emily, I think we probably have time for one more question, one or two more.
Yeah, so another question was, has there been any work done with member associations in regards to getting this work out to providers, like the American Academy of Family Practice, nurse practitioners, and PAs?
Emily, I think you might be the best one to take that one.
Sure, happy to. So we did actually, you know, primary care is such a critical partner in this work. We have historically had, you know, many primary care practitioners, health systems as part of our membership. And we actually hosted a summit on reaching primary care to find out, you know, what are their needs? What can we do to better assist them? Our, you know, STEPS guide for primary care is really one of our signature tools meant to make the primary care system's job easier in terms of reaching out to their patients. And there's over 200 pages of appendices with sample tools so that those can be used without having to recreate the wheel. And we are on an ongoing basis reaching out to those organizations to try to bring them into the fold, bring them to our meeting, utilize their networks. So, you know, appreciate your help in that too, as you recommend our webinars, programming, our newsletter to any primary care networks that you work with.
Great. And we are at time. Thank you all for joining us today. Thank you to our wonderful speakers, Dr. Itzkowitz, Michelle, Emily for managing Q&A, and of course, Aubrey for doing all the behind the scenes work. Please don't forget to fill out our evaluation. It's incredibly helpful for us. And like we said, we'll be sending a follow-up email with all of this information. We'll try to answer some of those additional questions we didn't get to. You'll receive a link to the recording as well as a link to a PDF of the slides. But again, I hope everybody's having a wonderful 2024, and we appreciate you spending your time with us today. Thank you.